I'm Dr. Pichini, and I'm a chiropractor in the Rexdale, Etobicoke area. And today I'm going to talk to you about a very common issue that people have, knee pain. Now, knee pain is very common. At any given time, about 90 to 20% of the population experiences knee pain. So almost about a quarter of the population has knee pain at any given time. And for those of us that are doing our exercises, if you have knee pain, it really affects the way that you're doing your exercises. Perhaps you're not working out your legs as much because of that knee pain, or you're not engaging in physical activity as much because of that knee pain. So today we're going to do a talk on how you can manage your knee pain while you're doing your exercises. So what sort of techniques can we use during our workout of our legs that are going to give us less pain or less stress in our knees so that we can still get results in our knees but not aggravate our knee issues? So first off, we'll talk a bit about the anatomy of the knee. So our knee is made up of three bones. So if you look here at this model here, this is our knee joint, and we have the femur, or we call that the thigh bone. We have the tibia, which is this big long bone, thick bone over here, or the shin bone as they call it. And then we have the patella, or the kneecap. Now, these bones are held together by a number of different ligaments and tendons. So if we take a look at this image here, you can see that it's not just these bones floating around. They're actually attached with a number of different ligaments. You have a number of ligaments that are attaching these bones together, and it's also lined, this joint, with cartilage. In addition to that, you also have these bursa. Bursa are these fluid-filled compartments that help glide our tendons as we're making some sort of movement. So typically, there are many different causes of knee pain, but in this presentation, we're going to talk about 4 common types of knee issues. One of them is going to be a knee sprain. So perhaps in the past you may have sprained your knee, or you may have had a very serious injury to your knee regarding a ligament that required surgery. Regardless of the issue, if you have a ligament issue, doing certain types of exercises are going to create more stress in the knee and be very painful for you. So a very common type of knee injury that you see regarding the ligament is the ACL. So you can see that you have 2 ligaments that are in the center here. One of the front ligaments, that's called the ACL, can sometimes be injured, and you can see that here. You can see a little tear inside the ACL ligament. Knee arthritis is also very, very common among an aging population. And in this situation, that cartilage that I was telling you that aligns your knee joint, that cartilage actually starts to degenerate. So it's wear and tear. And you can see some progression in this image here where over time that cartilage is actually degenerating and it's breaking down, and it gets worse and worse, and it actually erodes that joint, and it can be painful, especially when we're doing certain types of exercises. Another injury that's very common is the meniscus injury. So if you look at your knee, there's actually a pad between your knee that literally goes right between the knee. It's this cushion-like structure, and you can see that here, and that's called your meniscus. Now, the meniscus can have tears in it depending on the type of injury that you've sustained, and that can usually cause that clicking and popping sensation that you get in your knee, as well as a lot of pain when you're going into a deep sort of squat. And then another very common type of knee injury or knee issue is patellofemoral pain syndrome. And in this situation, it's pain usually at the front of the knee, and it's usually an irritation underneath the kneecap, so it's underneath the patella. Now, there's different reasons as to why that can be. A very common issue can be as a result of a patellar tracking issue, meaning that your quad tendons, ones that are on the inside of your knee, such as the VMO, vastus medialis, tend to be weak, whereas those muscles on the outside of the quads, called your vastus lateralis or ITB, those are tight. So it can throw off the way your patella sits in the center of the knee, causing irritation. So usually people who have this type of knee pain, they'll have a lot of pain in the beginning of their squat. They'll notice that pain going at the front of their knee. Regardless of what the cause of your knee pain is, we know that when you have a knee issue and you're doing exercises involving your legs, it sucks and it's really difficult to do those exercises, especially when you're going down into a squat or into a lunge. So we're going to talk about some key concepts that you should use during your exercises for your legs that are going to help to reduce that pain and help reduce the stress that these exercises put on your knee. So two key concepts that we're going to talk about are, one, the angle of your shin or tibia as you're doing your lunge or your squat, and we'll also be talking about the depth of the lunge and the squat when you're doing your exercises. So first off is the angle of the shin. So when we have our shin, which is our tibia here, if you're doing any sort of squat or lunge, that's going to bring the angle of your knee, or bring the angle of your shin forward. That can cause pain. And also the depth. So we know that the deeper that you go when you have a knee issue, it tends to put more stress on the knee, which can cause pain. So two different types of lunges. You have your forward lunge and then you have your reverse lunge. So you can see that when someone goes into a forward lunge, so you can take a look at this image here, this video. When she's going into a forward lunge, that angle of the knee tends to go a little bit more forward and forces more depth in the knee, which, if you have a knee issue, can cause more pain. When you're going into a reverse lunge, so when you're actually bringing your knee back, you can see that the knee actually stays more at 90 degrees. So you're not worried too much about the knee going too forward as you are with the forward lunge. So you can just see that when she's doing the reverse lunge, the knee stays at 90 degrees, the tibia stays straight, so it's not going as forward, and the depth of the knee is not as significant, which can put a lot less stress on your knee. Squats are another very important exercise that many of us do, and if we have knee pain or knee issues, if we're doing our squat in a certain way, it can actually put a lot more stress on our knee and create a lot more pain for those of us who already have knee pain. Now, if we look at the average squat, you can see again the tibia or the shin bone comes a little bit forward, and the depth of that squat are problematic because if you have that knee issue, as I mentioned, it puts a lot more stress on the knee. It can be aggravating. The box squat actually offers a really good solution to the regular squat in alleviating some of that stress on the knee because of two reasons. One, the angle, so the angle of the shin stays at around 90 degrees, which we like. And it also allows you to control the depth of your squat. So you can see in this video here, this woman is using some sort of seat or chair or box while she's doing her squat to control those two key concepts that we were talking about earlier. In this video, as she's doing the squat, there's a lot less stress going on the knees as she's doing that because she's controlling the angle of the knee and she's also controlling the depth. Step ups are another very useful exercise we can do to help to exercise our knees or our legs. And again, for the same reason as they're doing the step up, the angle of your shin can stay around 90 degrees, so it's not going as forward. And again, you can control the depth of your squat throughout this exercise. So if you take a look here, as he's doing the exercise properly, you can control that 90-degree angle and you can control the depth of the squat to put less stress on a painful knee. Deadlifts are actually another really great alternative we can use to help strengthen our knees without aggravating or stressing them out. So in the deadlift, if you have with weights, you can see that again, your knee doesn't have to go as forward. You can maintain that 90-degree angle as well as control the depth of your knee. So it doesn't require you to go as deep into a squat with this exercise. Although these exercises we showed you today are going to be less stressful for your knee, especially if you have a knee issue, doing some sort of physiotherapy or chiropractic for your knee can actually be a game changer for your workout. So those of us who have that knee pain, get it assessed by a professional, get it assessed by an expert. At Revitamax Rehab, we're experts when it comes to finding out what the cause of your knee pain is, helping you with a number of treatment solutions that are going to help to reduce the pain and help to restore its function, as well as teach you some exercises that are going to help to prevent this issue from becoming worse or from becoming a bigger problem in the future. At Revitamax Rehab, we're offering free consultations to help you assess what could be causing your knee pain and then solutions that can help to resolve those issues. So we're located just off the 427 in Rexdale Boulevard, so that's just in Rexdale, Etobicoke area. And if you give us a call at 416-360-8326, we can help book that appointment for you. We're also offering virtual consultation, so in the event that you're unable to make it into the clinic, one of our therapists will be able to reach out to you online, where you'll be able to be face-to-face with one of our therapists who will be able to assess and offer you solutions online. Thank you very much for listening to our presentation. If you have any further questions, you can always give us a call here at the clinic at this number we just mentioned, 416-360-8326. And you can also reach us by email at info@revitamax.ca.